Despite measures taken by the government to contain the COVID-19 transmission, new cases are being reported daily.
And this really should worry each and every one of us, because it's obvious and it's a bad indicator that the situation is getting worse within the country.
We know 2 counties now have established community transmission, that is Nairobi and Mombasa. About 3 or 4 counties are having large clusters, and basically this is because of truck drivers. That is basically Busia, Kajiado and Kiambu.
Out of the 2,718 samples collected, 259 people have tested positive for the virus. Nairobi leads with 127, Mombasa 39, Kiambu 22, Machakos 16, Makueni, Nakuru and Uasin Gishu 9, Kilifi 5, Kajiado 3, Kisumu, Lamu, Garissa and Marsabit with 2 cases each, with Kwale having only 1 case.
We are still exploring further possibilities of placement of various equipment with some manufacturers. Then we simply get the commodities from them, especially in far-flung counties. We are really concerned about Mandera and Turkana. For example, in Turkana, from Lodwar to Nadapal is 400 kilometers. So if you get a case, or suspected case in Nadapal, you have to travel 400 kilometers, then get that sample back to Eldoret, which is now 500 kilometers. So the turnaround time then is grossly increased.
Earlier this week, President Uhuru Kenyatta had indicated that the next set of measures in regards to reopening the country's economy will be highly dependent on county governments.
The nation is the sum total of our 47 counties. And if the counties have met the necessary thresholds, then the nation as a whole will be ready to reopen.
With every county expected to have at least 300 beds for COVID-19 patients, away from ICU beds and even ventilators, only 12 counties have met that threshold. The counties including Mombasa, Machakos, Nyeri, Kiambu, Uasin Gishu, Makueni, Kisii, Kilifi, Murang'a, Vihiga and Kericho. Other counties are still struggling to create half the capacity of the expected threshold, among them Kirinyaga with only 14 beds, Siaya with 19, Nyamira with 20, West Pokot with 21, Bungoma with 22 beds and Nyandarua with 23 beds. This according to a report released by the Council of Governors on the 23rd of June.
All the containment measures remain in place as the NERC continues to review progress. As counties continue to submit their level of preparedness, we will then be able to make a determination to that.
The Ministry of Health is now banking on the home-based care protocol to ensure that each patient gets the medical attention they deserve, as 80% of the patients in the country are asymptomatic. Rakam Ligai, Citizen TV.